stand and pledge allegiance. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Dear Lord, if you could please be with us here tonight in this room as we discuss important things on the agenda, things that are vital to our county, important topics, as we do your work and your will to ensure that our community has vital services for her. Yeah, amen. Amen. Sorry about that. Okay, all right. And first, we're going to open with the approval of the minutes. Has everyone had a chance to look at them? The January minutes?
Approved.
Yeah.
Could I ask a question before you
Yes.
approve it? Sure. Who does the minutes? Great job.
Well, thank you. Appreciate that.
Approved now.
And a second?
A second.
Second. All in favor? And next up, we have the executive director's report.
Good evening. I have a couple of items for you tonight. I'd like to start with a review of applications for your consideration. And there are 3 applications for you to consider this evening, 2 of them for community-based organization representative and 1 of them for psychologist. And you all can, basically, you're reviewing them and you are electing to either move them forward to the Board of County Commissioners to their consideration to actually make an appointment. There is only 1 position open for the community-based organization representative. However, you can choose to advance 2 applications for the board's consideration if you would like to do that, but you're not required to do that.
I have a question. So that community-based position would be between Eric and Jesse?
That's correct.
Has anyone met with them in person that could give us any more details in their resumes? I read the resumes, but I didn't know there was only 1 spot for them.
Yeah, and when we first brought this up at the last meeting, we did not have 2 applicants for this position. Since then, we have gained 2 of those. So if you guys would like to do interviews, you are welcome to do that. If you would like, you're welcome to do that. Or if you would like to advance both of them to the Board of County Commissioners, you're welcome to do that. However you would like to handle that.
This is for the community-based organization representative.
Yes, and that is loosely defined in terms of the criteria. Basically, anyone that is a representative of an agency that the Human Services Agency would like to partner with, or that might provide services to our clients on a normal basis.
You have 3, right? 1 for psychologist?
Yes, the psychologist is a singular application and a singular position. I might suggest that you all start with that one.
Yes. That would be good. Do we have a second to start with Mr. Childs for the psychologist?
Second.
Sure.
All in favor?
Aye.
So first tonight we will discuss Matthew Childs, who has applied for the position as psychologist. Has everyone had a moment to look at Mr. Childs or Dr. Childs' application?
He's right off the boat, 2023, for Charlotte. I would like to offer a motion that we support Dr. Matthew Childs for the position of psychologist and recommend to the full Board of County Commissioners.
Thank you, Mr. Tice. Do we have a second?
Second.
Thank you. And all in favor? For Dr. Tice? All right, next up, we have two people, as we discussed, that are applying for the community-based organization representative. We have, the first is Eric Clayton, and then Jesse Granger. So we could discuss this now, or as Randy had mentioned, one option might be that we decided to have a subcommittee to interview them if we wanted to look closer.
Not a definite, I just, maybe we can discuss this. Mr. Granger, I like that Miss Granger, I like that she deals with the older adults in community, which is a topic right now for us with Meals on Wheels and just helping that vulnerable population as it is. Not to discredit the other one's resume either. Those are just some things that stood out to me.
Did you say that was Miss?
Yeah, she's Jesse.
Yes, she's okay.
Could I ask a question? Do we have the ability to expand the number of positions to one of the
Yes.
classifications?
By state statute, the Board of County Commissioners has the ability to expand the number of positions. Because this is appointed by the Board of County Commissioners, and the state statute allows up to 25 positions. There are the positions that are required to participate, as noted in terms of the specific, like dentist, pharmacist, that sort of thing.
Right.
And then several of the others, like other person, as a for instance, is something that we've added.
Okay. So, we will still be left with several vacancies in other categories. I would be open if representatives of the board or subcommittee would like to meet with these two individuals, that's fine. Nominating committee, whatever you want to call it. But I don't have a problem with submitting both of these, this gentleman and this young lady, and expand the number of slots for that category.
Is there a substitute that we could do? Take one away and add this in, or no?
Probably some of them.
So, have y'all ever had, been pulled on recipients, like on consumers? Because I actually do think there would be a benefit to having people who are, working with nonprofits in our county and doing this work. Like, and if we haven't ever fulfilled all of the consumers, that I think that would be something valid to consider. The other question I had was, because Jessie lists at her spouse, working as family caregiver support and then family caregiver support specialist before, I was curious if perhaps she had a parent that led her to this that would qualify her also as a consumer if that wasn't an option.
So to answer, hopefully, all of your questions, please freak out if I am not getting them correct. But we have not, to my knowledge, and I would need to go back and look to be sure I'm telling you the facts on that, but had all of the consumer positions filled. We have always only had one community-based organization representative, and actually, when I say always, that position was created several years ago. So that hasn't been an always position that the Board of County Commissioners approved to be included. We cannot, Brady, to answer your question, change positions. The Board of County Commissioners can elect to have a different number in these buckets, but this board can't make that change, but we can make a recommendation to the Board of County Commissioners for that. And in order to find out the answer about Jessie, we would need to ask that question. I am not aware that we provide services for a family member, but we would certainly be able to find that out.
I like your idea too about having these community-based and almost it's almost like these two together make the perfect fit because they're both on opposite ends of community-based. And I see where Eric mentions his work during COVID led him to hospital at home, which is new to us in the hospital and very unique and has been amazing for us. So does anybody want to meet with him or put it to the commissioner?
Madam Chairwoman, just a little bit of historical kind of thought process. If you ask the commissioners to expand the board, just keep in mind you definitely are going to want to interview them because the more positions you add, the higher your quorum is going to be able to do the business of the board. So just remember as you're adding positions, you're also adding the quorum so that if you may have meetings where you're not allowed to do anything because you don't have quorum.
Should we do interviews?
So would we do that concurrent, or would we interview and then ask them?
So the way we had done it previously, Brandy, you were one of the ones we interviewed. We had a subcommittee that went through and met with the applicants and then made a recommendation back to the full board. The board then voted on that slate of nominees to send to the commissioners. If you're looking at adding additional person, that would be, and I'm certainly not trying to speak out of turn, but just as you're adding positions, just keep that in mind that you're increasing your quorum that you're going to have. So not saying don't do it, but yes, so get to your question, yeah, we have historically done the subcommittee and had them interview the candidates to make sure that they are committed and that they're not just here and there and that they're willing to be here when they need to be.
And for reference, Carla has spoken with them and confirmed that they are committed and that they understand the time commitment and that sort of thing. But in terms of obviously the rest of the interview, that process has not occurred.
Once a position is added, is it hard, like, when someone goes through their time frame and then let's say they no longer want to stay on, are you stuck with that position? Or does that have to go to the board again to withdraw?
But I feel certain that the Board of County Commissioners could remove a position through the same process that they would add a position.
That sort of goes, makes more.
But I've never seen that occur.
Yes. My question is, so we have an opening for a psychiatrist and a psychologist. Do we need both? I mean, both are
By
mental
state
health.
statute, you have to have both.
Oh, you do?
Yes.
Who's a mental health professional?
But you could move, you have two on the Consumer and Human Services.
Right.
So could we, to your point, take one of those positions, or the commissioners take one of those positions and allocate it to one of these?
Currently, is it 3 on the site or 4? I don't know if we have 1 or 2 that are currently in consumer.
I think there's
four.
We have,
I think
there
consumer
are
as
4.
well.
There are 4, and I think that is also state statute. I'm trying to pull that up now as well.
Could we hire one for the community-based organization rep and put the other one in the Consumer of Human Services, but they kind of collaborate together?
What was the question? I'm sorry, I didn't understand the question, Brandy. What was it?
So they're coming on to this volunteer board as, obviously, both of them are going for the community-based organization rep. I'm not sure if one would be willing to take up the Consumer Human Services. Like, if the one who gets the community-based organization rep, does that entitle them to something that the Consumer of Human
No,
Services?
they have to actually be a consumer, so they have to be
Right.
someone who
They have to be a consumer and willing to switch
Foster.
their application as well.
If that was the case.
Right.
Okay.
But if they were, the guardian of someone who was a recipient or a foster parent or, then perhaps we could switch. But we could find that out in an interview if we decided that. Does anyone have any thoughts on
I know the last time we had interviews, I think it was very insightful, and I would just say that I'm a consumer, and I think I only have 2 or 3 months left on board, so that's just as Emmy was saying, if the person is receiving any type of benefits, say you say a foster parent or anything that might be associated, that might be something good to at least interview them so you can see where they're coming from and what their further in-depth background information from.
So may I read just real quickly for your benefit the general statute? And I will paraphrase a little bit just because obviously it's long. But it shall be composed of no more than 25 members, and the composition of the board shall reasonably reflect the population makeup of the county and shall include 8 persons who are consumers of human services, public advocates, or family members of clients of the Consolidated Human Services Agency, including 1 person with mental illness, 1 person with a developmental disability, 1 person in recovery from substance abuse, 1 family member of a person with mental illness, 1 family member of a person with a developmental disability, 1 family member of a person with a substance abuse problem, 2 consumers of other human services. Notwithstanding subdivision 1, a Consolidated Human Services Board I should have just read this first, not exercising the powers and duties of an area mental health or developmental disabilities or substance abuse services board shall include 4 persons who are consumers of human services. So that 4 persons is required. And then 8 persons who are professionals, each with qualifications in one of these categories: 1 psychologist, pharmacist, engineer, dentist, optometrist, veterinarian, social worker, and registered nurse. And then 2 physicians licensed to practice medicine in the state, 1 of whom shall be a psychiatrist, 1 member of the Board of County Commissioners, and then other persons, including members of the general public representing various occupations. And so that's where we've changed our number of other persons, and we have added the community-based organization representative.
To me, it wouldn't be so wise. I mean, I think a consumer would have a lot of voice, would need to have a voice on the board as far as I'm concerned. You know, they're the one receiving the benefits of something. If they have some complaints or want to bring something to the board that might not be
right.
so
visible. The 4 consumers are required. Those positions are required. So there is not, basically everything on here, there's not an opportunity to change.
So the first thing that we could decide if we're going to set up, if we're going to convene a committee,
I think that would probably be the best step of this.
given the fact that there are 2 really look like solid choices, and only 1 slot, I think it is warranted to interview them.
And actually, I think we should interview everybody, whether there's more than 1 person applying for the spot or not, to gauge their commitment and their.
That's how it worked when I came in.
Yeah, exactly.
Me too.
That's any board.
We did interviews, but
Yeah.
apparently that is not always the standard.
I know, it takes time. We could do Zoom interviews, so folks don't have to drive all over Creation or where they're coming from to expedite the process and make it easier. And I'll volunteer for the, since I'm going to be carrying the ball from here, I'll be glad to volunteer to be part of the, what do we want to call it, review or appointment subcommittee.
So is that a motion to do that?
Sure. I'll make a
I'll
motion
second it.
that we appoint, how do you want to do it? We'll take volunteers,
Yeah.
and how many do you think people we need?
We need at least 3.
3? Okay, so you got 1. Make a motion.
Well, we have enough, yeah, so,
You have 3?
we probably need 2 volunteers, so that would give us back to an odd number, you know?
We just have
Because we have 3 on executive committee, so with you, we're at 4, we need 1 more.
And we just have to talk to Janet before the end to get a date, and then we can figure out who could do the interview. That's how we did it last
Yeah.
time.
Once we have the date chosen, I can set up a Zoom course.
Okay. But I was thinking we're going to have a subcommittee, and everybody on the subcommittee is going to participate unless schedule prohibits in the interview.
Correct.
All right. So I'll move we establish a, what do you want to call it, candidate review committee, subcommittee, to interview new candidates, new applicants for appointment to this board.
I'll second
All those in favor?
All right.
Any opposition? Now, with regard to approaching the Board of Commissioners, it sounds like it would have to be to expand from 19 to 20. Like, it couldn't be a replacement. Are there
it.
any?
Do we think we should, I heard what you said as far as the quorum, and I think, haven't y'all ran into that problem at one time? should we move for that quite yet before we do this interview and see? We may come to this interview and say, we have one and we don't need to expand.
Or one bails out.
Or one qualifies.
Absolutely, you should do the interviews first.
Do the interviews first,
Yeah, there's no
and
question.
because I don't want to ask to open up an extra slot
If we don't.
unless we haven't interviewed the person yet,
Mhm.
persons.
So I think that we have decided on that.
Okay.
So with that, just for clarity, we're going to have the subcommittee. How are those members of the subcommittee going to elect themselves to participate or not?
Well, either they volunteer or we will select
The
them.
last, you gave us a date,
Right.
and we were able to talk amongst ourselves
The
to,
executive committee and then whoever volunteers to join it.
Great, so what we'll do is Carla will work with you guys with the executive committee and these candidates to figure out a date with 3 time slots, and we will set up those interviews and then let everyone know.
So if anyone's interested in joining us on that, please let us know. Next up, we had a request. Yes, for the budget, to review high-level info of the current fiscal year 25 budget for human services and a review of the summary for fiscal year 26 for the base budget request.
And so I just wanted to provide you all with a high-level review, and I want to start by thanking Mary Chicory, who is sitting next to me, who is responsible for all of our budget and fiscal activity in human services, and she and her team are part of Jackie's business operations department, and they do an amazing job. And so we're going to tag team this, and I'm probably going to let her do most of the speaking. But what we have put in front of you is simply high level for FY25, our expenses.
Sorry, Janet, can we make that a little bit larger?
You can, and it is also in your packet.
Sorry.
If you flip to page 21. So we have the expenses budgeted, and what you see is $55 million. That is our general fund expenses. That excludes multi-year funds, which are really sort of a separate bucket. And then $27 million of revenue, and the portion of that that is county funded is $28 million, which represents 51% of our total budget. And then looking at our expenses incurred year-to-date and our revenue earned year-to-date, or actually earned and received year-to-date is more appropriate. And that was through February, which through February we would be looking at approximately 66% of the budget to be expended or earned. And you can see the percentages there. Overall,
Good job.
for our expenses, we're a little under there at 33 million, which is 61%. And our revenue is only booked at 12 million, so that might raise a red flag. And I would love to have Mary speak to this a little bit, but I'll let you, well, would you like to just go through it? Or there's some very good reasons for that. One of them is that the DSS reimbursement process through the Department of Health and Human Services is typically at least a 2-month lag in receiving that revenue and posting that, and sometimes it's longer than that. And so that is one of the biggest components. And then with community support and outreach, theirs is a little bit different, but the programs in that budget typically have a correlation of 1-to-1 expenses to revenues. And so basically, if services are requested in some of their larger buckets, like the LEAP program, which is an energy assistance program, as a for instance, if the expenses aren't incurred, the revenue isn't received. And so that's going to be a 1-to-1 there. And then with public health, there has been an increased use in contract staff and interpreting services in the clinics, which has increased expenses a little bit. And the revenue will come in, that a lot of that revenue that comes in is insurance billing, which takes a little bit of time, as well as Medicaid billing, which also takes a little bit of time. And so similarly to the social services revenue, there's typically in that space as well. And then for transportation, the claims for reimbursement are submitted quarterly, and so that definitely creates a lag that can extend through the following fiscal year, but then ultimately is reconciled.
Could I interrupt you for a second? Could you go through these acronyms on your chart?
Absolutely. So, Community Support and Outreach is CSO, and that is Stephanie Starr's department. Human Services Administration is the second bucket. That is Jackie Morgan, which is Business Operations. Social Services, Ashley Lance is DSS. Public Health is the PH, and that is Tracy Colley. And Environmental Health is now a part of the Public Health Department, but when the budget was created this past year, that was not the case, and so they're shown broken out separately and for purposes of looking at this year's budget. Veteran Services, Michelle Marcano is the VS, and UCT is Union County Transportation, and that is Teresa Torres. Thank you. I apologize for forgetting that one.
No, that's okay.
So typically, in terms of the revenue that we receive, just for what it's worth, we've done a pretty good job of budgeting revenue. And while, again, it seems like maybe we're not on track based on what you're seeing now, by the end of this year, which actually doesn't usually close until August, even though the fiscal year ends in June, August or sometimes September, but I mean, usually end of August, yeah. So, yes, sir.
I'm just gonna, this is probably more for Ashley. You know, since we've been in with Medicaid expansion now, have we had significant numbers as far as more expenses for, you know, manpower for Medicaid since, I mean, I guess I'm asking how many positions were really.
Yeah, we added a total of 10. We added a supervisor, a tech, and 8 eligibility specialists for Medicaid expansion, with 9 of those typically, well, 8.5, 9 of those typically being reimbursed at 75%, and the county only having to fund about 25%. And then the supervisor, as you know, about 50% of their salary is reimbursed by federal dollars. So it's a little easier sometimes for me to add those kinds of staff because of the reimbursement rates that we get.
Have those applications significantly increased since that time?
Yes.
And which bucket is that?
Under DSS.
Okay.
And we'll cover some of that application increase
In the data portion.
So the revenue from DSS is reimbursement from the state?
So we get, you want to answer, Mary, or you want me to answer?
Let Mary answer.
Okay.
So DSS, it's broken up into several different budgets, but yes, most of it is from the state. We get 75% reimbursement, as Ashley said, for our Medicaid food stamps, a lot of our child welfare. Those are all at 50% that we get reimbursed from the state.
And those state reimbursements are running at least 2 months behind.
Right, it's the process that the state has built out, and so we enter the information into their system, and then they process it, and it takes about 2 months for us to receive it, yes.
Get to it when they get to it. So that makes the revenue figure kind of misleading because your expenses, you are incurring them real time, but expenses are lagging 2 or more months.
Our revenues,
So
yeah.
revenues, yeah. So it makes a deceiving picture when you look at the DSS category. It looks like you're artificially behind in the revenue portion, correct? All right, okay.
Can you put an expected revenue column?
It is, so if you go up, here, well, that is expected.
Oh,
Yeah, that's our, yeah, our
So the
budgeted
total,
amount.
basically the expenses, next to, in the top section there, the total expenses are 25 million, and the revenue column of 16 million is the total ultimate expected revenue.
So that's what you've submitted for reimbursement, whether you've received it or not.
That's what we
That's what we
budgeted
budgeted.
and
That's what-
anticipate submitting for reimbursement.
Okay. All
You're
right.
saying how
That's what
much
you
have we
should be
submitted?
getting.
I mean, you're expecting
To receive all of it,
to receive all of it.
all 16 million
Okay.
ultimately.
Okay, so that isn't accurate. If all things go as planned and the state actually does cut the check for that that's what we should be seeing. But
And
as
we-
far as
and
getting
we-
it in hand, there's a lag.
Right, correct.
I'm with you.
Okay.
Not to jump ahead, but when you start talking base budgets, that's without the salary?
Correct. You want to jump ahead?
Well, I just wanted to, I was trying to see if there was apples to apples.
There's not.
Would you like for her to proceed to base budgets? Anyone have any questions on,
I have just one quick question. The fiscal year 25 year to date, next to DSS, it says the 15 million. The revenue up at the top for that is 16. Does that mean that you're almost tapped out at that amount?
No, the total expenses that are budgeted are 25 million for DSS, so the first column there in the top section. And so we've expended 15 of 25.
Okay, oh, got it.
Which is 61%, and to be on track would be 66. So as far as expenses go, to carry that scenario further, you're ahead of the game,
Right.
over budget.
Right, or less,
To date.
we're spending less than what we expected to spend.
Right, to date.
To date.
But how many more months left do you have till, so we have
Five.
till June, right?
5, yes.
So
So
we
this
have
is
the rest of
January.
March,
Yes.
April, May, June, so
Yes, so
about 4 months.
This was run at the end of February, so there may be some expenses that hadn't
Sure.
hit yet, but that would be 66% that we would have expected to expend through February.
Okay, so you've got 10 million to go for the next 4 months.
Correct.
2.5 million a month.
Say again?
So 2.5 million a month.
That's right.
Gotcha. Okay.
Your math is faster than mine.
the new fiscal year starts July 1st.
Yes, that is
On the
correct.
state.
Through June.
Yes,
That's how I interpret
through June 30. Good question. Sorry, that is, I can see how that's a little confusing. So the upper column, expenses are total expenses. And then the revenue, what covers those expenses, because we have to have a balanced budget, because that's state law, the counties have to have a balanced budget, period, is either revenue that is not county general fund dollars, or the county funded portion that is county general fund dollars.
Okay, so let me take that a step further, if I may. Down the fiscal year 25 year to date, take the DSS figure, reimbursements received. Is that actually, we've got it in our account, or that is what we have
Those are
submitted?
dollars that have come back into.
Okay, so
the
that's
account.
where the lag shows up.
Right. Correct.
All right. So that makes that 61% even better?
Yes. Well, so, yes, but no, because one would expect that if we spend less, we will not get reimbursed
Oh, I see.
for revenue that we
Yeah, sure.
don't spend.
Sure, sure.
I mean,
Yeah.
yes.
Okay.
But all in all, yes, it's better. If that number were much higher than 66%, then we might think, oh, there's maybe an
We're
issue
blowing
here.
through it, yeah.
Right.
So is that the 1% difference between the 62 and 61?
I'm sorry, help me.
When you, yeah, we're talking about DSS.
Yes.
And the percentage expected through February, 61.
66, sorry. The total that has been, so that header should actually say percent of amount through, that has been expended. The word expected should not be included there. Sorry. That was definitely confusing, and that makes sense also.
And so what you're saying, if you're dead on your budget, expenses versus revenue, be 66%.
Correct. Yes, if we had
At
spent,
this
if we had
point, yeah.
spent and earned and received every dollar.
Gotcha.
Yes.
Any more questions on page 21 before we talk about base budgets?
Is there any of the budget items in this current fiscal year that are sticking out from the last fiscal year? Any increases or decreases from the previous year. Does that make sense? No?
Yes.
I would
So,
assume, because was the last fiscal year, when did the expansion of Medicaid really kick in? Is this the first fiscal year that we're really seeing the effect of that?
Right.
Full, okay,
We fully budgeted for that last fiscal year.
last fiscal year,
When we did FY '25, when we
Right.
created that budget,
this,
yes.
this budget.
this
Yes.
budget. Okay,
This FY '25, yes.
So
so
this is
that
the
would
first.
show a contrast to last fiscal year. Because of the expansion of Medicaid, this is the first full fiscal year where that kicks in. So if you look back to fiscal '24, you'd go, well, why is this DSS figure higher? And that's because of the expansion of Medicaid.
That's right.
Is there anything else in these items that are sticking out either higher or lower from fiscal 2024? Does that make sense?
In public health, we have received some revenue that we had not previously received. That's basically from a capitation perspective for our for our care management for Medicaid. So we've seen funding that we had not previously realized. We started to see that, and that kind of has helped us with budgeting or creating the budget for the FY '26, the upcoming budget year.
So efficiencies in the system of filing or receiving claims, is that what you're saying? System improvements?
It's basically because we have patients who receive care management services through public health,
Okay,
Medicaid, the different PHP plans, the different Medicaid plans, they give us a payment each month for those children or pregnant women who are assigned to public health to receive services.
okay. All right.
And the only other thing that I think is a bit of a, I think we would say through all of the departments, we've seen an increase in our interpreting services.
Yeah.
So that's been a cost to all that we've kind of adjusted again as we plan for this next year. So if you have somebody, we have to provide services, like if someone comes in and they speak Spanish, we have to provide services for them using an interpreter who can speak to them, whether it's DSS, public health, community support and outreach, we have to have that service available.
And that cost is increased?
Yes, we've seen more individuals needing the service.
Is that specific to languages, like specific languages? Like we all know Spanish is pretty.
Any language.
Right.
There are lots of languages.
Why do you think it's costing?
Ukrainian.
That's in Ukrainian, Russian.
I'm trying to, like a shift in the population? Is that what you're asking? Yeah, because we have discussed that in a previous meeting. We are experiencing that.
Yes.
Have you done a cost comparison between individuals for that interpretation versus like language on wheels? Like a computer that has all the languages on the
That's what we use.
That's what you're
Yeah.
using.
Well, we have in-house interpreters as well as, we don't call it language on wheels, but VRI.
Do you know if we exceed 8% of the national average for limited English proficiency? As a county, do we have more than that?
For Spanish speaking, we are required to provide everything, and we exceed the threshold, and we are, for our Spanish speaking residents, we exceed the threshold, and we are required to provide all of the information in written format as well as the interpreting. But regardless of a percentage of population, we are required by law to be able to provide information verbally and provide services to someone. So for our interpreters are Spanish, and we have one Russian. And then everything else is done through the VRI.
And how many of those are
There's
there?
2 teams for interpreting. There's one in business operations. The team at my shop in business operations, we have a supervisor and 5 interpreters and 1 part-time. And they basically serve DSS and everybody but public health, because public health are, actually also perform some medical. So those are different type of interpreting. It requires a different type of certification. So there's two teams, and we do support them from my team, the ones that have passed that certification. We can step in. We do a lot in dental and WIC to support those teams as well. So they have a whole team in public health that focuses on the clinical services, and we have the team in business ops for everything else. They also do after hours for Ashley's team for CPS that goes out into the field. And then we only use the VRI in gaps when we don't have coverage.
So a notice did come out today that there's going to be a public briefing on language services on the 21st of the month. So I'm not sure what the announcement's going to be, but it came out today from the offices of ORS.
Say the date.
March 10th. It's going to be on March 21st, but it came out today, the notice. Base budget now. Anyone have any questions on this before we move on?
Okay, so for FY26, this probably isn't everything that you guys were hoping for, but it's what we have to provide for you. So, Amy, you correctly surmised that the total of $9 million does not include salaries and benefits, and so this is what we were provided and what we have to adjust because salaries and benefits are what they are, and that is handled at the enterprise level. And so our base budget that was presented to us for FY26 is $9.4 million, and we were requested to provide a 2% reduction, and you can see that broken down by each of our departments, a total of $239,000. And what we have done is we've worked with all of the department directors. We've obviously met, and Mary and her team have done an excellent job of identifying opportunities for that reduction, and there are lots of different reasons for that, which really are probably more appropriate for the county manager to be providing as information. And so if you're interested, I strongly encourage you to watch the budget updates over the coming months in that space. But effectively, we have presented options that would include cuts to individual line items that might impact service, and if there is a service impact, then we have the opportunity, well, we share what that is. If we think that it is significant enough to need to request those funds back, then we will have the opportunity to submit that as service level. We have a service level 2, which is things that we're already doing that we're requesting to have back, and a service or that just are going to cost more for next year for whatever reason that we can't cover with our existing budget, and then a service level 3, which is an expansion request. And so that obviously would have nothing to do with this if we had a need above and beyond what is currently provided service-wise today. And so we have worked through this, and the other thing that sometimes we have an opportunity to enable is revenue. Obviously, that does impact the potential reduction as well, or would. And if our revenues were going to go down, for instance, then we might have to, we would have to adjust our base budget additionally. But the good news is we don't expect, at least at this point, based on what we know from any federal or state projections, which is limited at best, but we don't expect any revenue decreases from this year to next year. We do expect some increases, and so, but all of that, we're still working on all of this from a FY26 budget perspective.
And which bucket do the in-home services and senior nutrition come out of?
So senior nutrition, it falls within the community support and outreach bucket.
Okay.
And the in-home services falls within the DSS bucket. And I would, Amy, just so I don't forget, like to address one thing in association with senior nutrition before we finish my update portion. And so the senior nutrition, as a for instance, I can tell you that Stephanie and her team, along with Mary and Emily Colson, have worked to prepare several SL3 expansion options for consideration with senior nutrition. One of them would include our current service and just ensuring that we're able to continue providing service to the people currently receiving service, or to the volume currently receiving service. And then we have everything from that all the way up to what we had discussed during the Board of County Commissioners update, which is having everyone off of the waiting list receiving not only the 5 meals during the week that would be either warm or frozen, but also weekend meals, shelf-stable meals. So we have multiple different options for those components.
Can I ask a question about the Meals on Wheels? Is it a possibility to ask Atrian to help with some of that funding?
Funny you should ask.
May we come back to that?
Yeah, I got something on
Just that way we can do all of that at once. Is that cool?
Yeah.
And actually, if you want, well, does anyone have any questions about that FY26 budget at this point? Okay. If you want, we could hold for a moment on the service and performance.
I do have one question that's on,
All right.
sorry.
No, that's great.
Just because on the base budget, it doesn't include the salary, what happens when you are, don't have it fully staffed for the year? Do you lose that funding?
No, so, obviously, a large portion of the expenses, because most of the services that we provide, let's say a physician, for instance, right? You're coming in, receiving services from a nurse or a physician, and so that salary is a large portion of the services that is provided. If a position is not filled, we simply don't have that expense. That expense becomes something called lapsed salary. That lapsed salary is, money that is not spent, that is in the general fund often, but not always. For instance, for the social services positions, they are either 50 or 75%, or sometimes a balance in between those two, but reimbursable. If they're reimbursable at 50 or 75%. So if we were to, let's just pretend we were to cut a position, right? If we were to cut a position that cost $100,000 total with salary and benefits, the county would expect to receive, and that if it were filled, the county would expect to receive $50,000 of revenue, right, for that. So the county portion of that $100,000 would only be $50,000. So we would also then lose that revenue is the point. So the expenses would go down and the revenue would go down in some positions. In other positions, there is no reimbursable expense, and so it would be money that the county could choose to realign for that year, assuming again that the position wasn't filled. Most of our positions are filled. It just is they rotate. There are always vacancies, so there's always going to be some lapsed salary that's going to be accruing. But the intent and the hope would be to balance everyone's workload and be able to have all the positions filled. But that isn't how life works always.
So the base budget does not include employee expense.
Correct. No salary or benefits.
No salary or benefits.
That's right.
So if you basically added that back in to mirror your fiscal year 25 budget, where would we be in relation to that 55? In other words,
At 55,
okay,
I think, right?
even
Yeah,
without the
pretty much.
2% reduction, just
Well,
on your base budget?
so the
add
2%
everything.
reduction hasn't been taken yet officially, so
Right.
what we were assigned to do was they said, here's what you start with.
Right.
Now, find 2% of that, so let's say we start with 55, except
Right.
for that we didn't. But find 2% of that.
So if you were asked to submit your full, or when you're asked to submit your full budget, it's going to reflect right at the $55 million figure? You don't anticipate that?
That's correct.
Okay.
So the way that well, obviously that is strictly up to the county manager in terms of what he presents to
Right,
you
right.
all and then what you all choose to do. But We are not proposing to, we're proposing to maintain all of the positions that we have today.
Okay, that's what I was looking
If we have no more questions on that, we will move on to next on our agenda is, well, actually, Janet, do you want to cover?
Let's do your,
Because
why don't we
that
do
might make
senior
more
nutrition
sense.
since we sort of switch to that, then we'll go back to the
Yeah.
performance component. So I would like to recognize Commissioner Gary Sides and our Community Support and Outreach Director Stephanie Starr just to provide a brief update on senior nutrition. We've had a little bit of exciting activity in that space over the last couple of months. So we have a lot of conversation that is occurring with the Board of County Commissioners, and then internally from an operations perspective, Stephanie's going to be able to provide an update on our waiting list activity and some work that we're doing there to try to refine, because obviously everything is a moving target. And then also some exciting partnership opportunities. So Brandy, you asked about Atrium, and that's something that we would like to explore lots of different opportunities, including with municipal partnerships potentially. And so I'll press pause. And Stephanie, why don't you start with the update on the waiting list and anything else you want to say there?
Sure. So just to give everyone an idea, so we've been working on going through our waiting list. So we have people from 2022, 23, 24, 25 on our waiting list. And those are folks we have not been able to add to the meals for a variety of reasons. One, if they live out in the far areas of the county, they would have to go on frozen meals. We actually have had to decrease our numbers of people receiving frozen meals because we lack the funding to be able to add people back on once people are off of that. Also with our ward meals, I think we've had this conversation already, the meals went up 34% this year. And so when people have been taken off of our warm meals, we haven't been able to add additional folks. We have here and there, but we really haven't been able to because we were actually short on funding everyone for meals who are on warm meals this year by, it started out about 125, 130,000, and it's gone down. So in terms of our wait list, we get about 25 people added per month to our wait list, and those are people who've called, who we've confirmed need meals. We have a basic screening, we prioritize them. So we average about 25 people per month. So we decided, we really do need to go through the waiting list. We've been sending letters out to people on the wait list twice a year saying, hey, if you no longer need meals, please contact us. It doesn't, we really only hear from maybe about 25, 30 people that say, hey, we don't need meals anymore. Otherwise, we don't hear a whole lot. So we really wanted to confirm who is and isn't on the wait list. So unfortunately, my staffing capacity is really small. I have mostly part-time people who are only here half a day and either running a meal site or covering a meal site or covering our volunteers or doing assessments on the people who need them twice a year. So we've actually engaged a couple of people, not quite a few, one of them being Dave, who's in the back of the room here, who's helped us out. He's from Jackie's shop, and a few other folks from other areas to start making calls, and some of my staff. We've been able to get through to 76, and I'm going to read this because it'll make more sense. So we've contacted and updated 76 seniors, and 43 of those were removed. Another 40 are in process. So the whole process has been, we're going to make a phone call, they don't answer. We're going to make another phone call, they don't answer. We're going to contact their emergency contact if they have it, don't answer. Then we send a letter. So in process means they've either gotten two calls, and we're still trying to get a hold of them. Don't reach them, we send a letter to them. We have 28 that are completely unreachable, that we've gone through that whole process, and we've sent letters to them. And we'll give them 2 weeks to get back to us, and if we don't hear anything, we will remove them. So we want to give people the opportunity to respond. We don't want to just take people off of the list. So it's very time consuming. I think Dave can attest to that. So so again, those are our numbers, and we currently have 590 on the wait list. We started with 608, we added 25, and we took 43 off. So that's where we're at right now. As you can tell, we still have a lot more people to go and call. It's going to take time because it's not an immediate response. Again, a lot of times we're making 2-3 calls to the household, unfortunately. So it's just a very time consuming. We don't have any full-time staff to do it. So we're taking people who have the time to be able to make those calls.
I'm sorry, how many did you say you started with? 600, how many?
608. We removed 43, but then we added 25 that month. And again, that's out of the 76 we were able to contact. We have another 28 that we can't reach, and 40 that are in process right now with phone calls. So 130 something, 140 people that we've reached out to in total of that list. And we're also prioritizing them too when we do get through to them. So making sure that is completely updated as well. So again, taking that time to do that. Hoping in the next couple of months 2-3 months to get this all taken care of, but again, it's very time consuming.
And it continues to grow.
And then some really great news is that Wesley Chapel has agreed to fund their waitlist clients. We reached out to them and discovered of the 7 that we had that 4 of them, a couple of them were deceased. They had passed away in the last 6 months, so it was pretty recent. One of them, actually 2 of them, one was with a family member. One said that they, living with a family member. A couple of them said they didn't need meals anymore. Well, good news is we're starting 3 people. We thought it was only going to be 2 from Wesley Chapel this week on Thursday. One of them who said they were living with a family member, we discovered that the daughter who that person lives with is a school teacher and was coming home in the middle of the day to feed her mom and go back to school, which was creating an enormous amount of stress for that family. So we added them to the meals, so 3 in total. So we're excited about that, and other opportunities. Love to hear about the atrium idea that we have. So yes.
Well,
yeah.
that's about all it turned out to be, was an idea. I contacted Atrium, the regional exec or whatever over the hospital, who I guess works out of Pineville. I can't recall the name. I was deferred down to somebody, and from my conversations, Atrium directly is not going to be a player. But they did give me one of the part of the board, a local executive board for Atrium, is serving on a board for a Mecklenburg County-based organization called Nourish Up, which is the old Loaves and Fishes. I've reached out to them, explained the situation. They actually handle this service for Mecklenburg County. Mecklenburg County, the way they have it is they have their senior nutrition, and then Nourish Up actually handles the Meals on Wheels. Now their model is a little bit different. They don't do frozen and hot meals. They do refrigerated meals. And they charge a fee anywhere from $1 to $5 based on ability to pay. They have their own facility in Charlotte, and they also are in the process of constructing their own commercial kitchen. I have not had a response from them of what they may or may not be able to do. I don't know if that's good news, that's bad news, but as soon as I get a response, I've explained to them, I'll hand it off to the appropriate people, and you guys run with it. All I'm doing is just doing a little bird dogging. I also, and I understand you might like to speak to it, made a contact unbeknownst that you had contacted them as well, Stephanie, Food for Families. And I understand you have, and some of your staff have a meeting. The difference with them is they do not provide meals, prepared meals per se. They provide groceries. So you'd almost have to, again, tier your candidates on the waiting list for those that can prepare their own meals. It sounds like you're not going to just be able to, here's your lunch with them. They don't have that capability. So, hey, some help is better than none, right? So hopefully you will have an opportunity. I'm backing away from them, and your meeting hopefully will have some potentially good outcome. You'll see in the minutes, I made an initial run at my colleagues for funding. Senior staff, county staff worked out, and with Ms. Payne worked out another opportunity to use the unfilled, I'm sorry, what did you call that? Unfilled salaries. Lapsed salaries. Use that funding from this year, which is approximately $68,000. They estimated we could feed 110 families. That would also commit to continuing to feed those 110 families another $258,000 in the next fiscal year budget. So we could pick up pretty quickly feeding 110 additional folks with found money, but we would have to commit an additional $258,000 next year to continue through the whole year. And unfortunately, I'm sad to report my colleagues did not support that, my motion. So we're back at square one.
And that was even with the possible 239 cut, if it ends up being cut with the 2%?
You mean the funding is cut?
I mean, well, the base budget, if it does go down 2%, us asked, it's 239,000.
Yeah,
We're not that far from a commissioner's standpoint, we're not that far into the budget. I haven't seen anything yet. So I don't know where senior county staff is, what they're going to do with what the options Ms. Payne submits. I'll say it again. I've committed that if we don't offer more resources to eliminating this waiting list, I'm not voting for the budget. Now, I'm only one of 5. And I don't have to tell you all about the county reassessment and all the hoopla, the concerns of our citizens on that. That all comes into play in the budget. We all know how it works. So I can't say, but basically we're going to have to put our heads together. We're going to have to figure out another way. It's not going to, I have serious concerns if there's going to be significant additional county funding for this. It's just, I don't want to lead you astray. You can ask, but unless Ms. Payne, your staff, can find money from another place and convert it, that, hey, great. Let's hope you can do it. Ma'am.
Stephanie, I have a question because I kind of took this on a personal level through some networking that I do as well. Because I was hearing from some people in the community as well that taxes going up to pay for some of this is not an option for some too. Because there's some elderly in Union County who can't afford the tax increase but don't qualify for the Meals on Wheels. Have you heard of Faith Community Health Ministry? Their Department of Atrium. I didn't know about this either. Can I make this connection with you before you leave? as a possible, I spoke with her, and they said that they have a network with Blue Cross Blue Shield who has been looking to do some funding that might be an option in this.
It's like a grant of some kind?
Yes, yes.
And what's
Now, she doesn't know for sure, but she said she's newer on this. There used to be a relationship between this group. I didn't even know, I've been in the system at Atrium since 2007. I didn't know about this, but they are a department out of Atrium. They do a lot of community health work. They wouldn't per se do the funding, but they do a lot of collaboration work with someone from Blue Cross Blue Shield who
Help you
looks
fund.
for things to help fund. So maybe you two can talk and see if this is something that falls under.
That's what I was gonna ask. When you talked with Atrium, was it with the strategic community engagement?
That's where I tried to start, yes, and I got kicked to somebody else. And they brought it,
A partnership with United Way? I mean, not with United Healthcare on that?
Say that again? About
United Healthcare, like for grant funding?
couldn't tell you.
Is that something that the county's ever had a relationship with before?
Couldn't tell you. What was the department in that you're talking about?
Faith Community Health Ministry.
I even thought about Atrium, they have a foundation. Is that, possible to tap into that for grants? I mean, they're not for profit, right? Or nonprofit?
I would think a little bit, I don't sit on their finance board, but
Okay.
that was my first thought with Atrium, especially being, now we have 2 hospitals in Union County, and
Well, I don't want to step on what Stephanie's doing, so, yeah.
Yeah, I mean, we're always looking for funding. I believe, but I could be wrong, that the foundation may only fund nonprofits and certain initiatives. I know that they,
Yeah.
kind of like every other foundation, they have certain initiatives they
Right.
want to fund. But, I mean, we always can look into things. Doesn't
So maybe
hurt to look.
if like Food for Families panned out in some area, then they could go to, who I'm sure they have Good Source and others, foundations for increased funding to help with a possible senior nutrition expansion. Whatever.
Possibility.
We also have a new budget director who is also responsible for grant writing. And there's supposedly going to be an expansion in that area. I would think there are nonprofits, organizations, arms of like Blue Cross Blue Shield that could be approached for something like this. I guess, correct me if I'm wrong, the hard part is that the foundations are not going to contribute directly to the county to fund something like this. It has to go through another nonprofit who is actually doing the work, right? Is that usually the case?
Not usually. Like, we've been, had
Okay.
a small amount of funding for Meals on Wheels, but real small amount. And we've applied any time that's come up,
Right.
but we've been
Okay,
turned
so
down
that's
a bunch of
possible.
times. But it depends upon the foundation. I think
Yeah.
it really depends upon their criteria
Yeah.
what they're going to fund.
Okay.
You had another question?
Yeah, what's just general criteria to get on Meals for Wheels?
Meals on Wheels. So it depends upon what your type. You have to be 60. 60 and over, and so the congregate site 60 and over, or you have and spouse or a spouse that's 60 and over, and you can go with them. For homebound, it's a little more. Those are folks that are more shut-ins, can't mobilize, don't have anyone to also support them with providing meals. We are not allowed to ask questions about income. We do ask questions, but we're not allowed to ask specific. We can ask, hey, are you, are you below the poverty income? But we can't ask specific questions. That's not allowed from our income or funding from our HCCBG grant. So,
Are any of the meal deliveries medically tailored?
they're not right now.
But then how do you determine if somebody's really
The need,
suitable?
like a true need versus
Well, we do, remember, first of all, we do that screening, but we do have to go out and assess them in person to make sure that they have the needs. So we have to assess them twice a year, once in person and once by phone. Or in person, if we really feel like it needs to be twice, we'll do that. So they are assessed twice a year.
How many citizens are we serving right now?
With meals, so we have about 150 homebound, 100 and I believe, to go back and look. And then we have a little over 100 at our congregate sites.
And that's a separate from the 590.
What was that? I'm sorry.
The 590 is on the wait list.
Yeah.
We have 590 on the wait list.
Correct. Way more on the wait list than what we're serving.
Yeah,
So when we had COVID funding, we were able to serve more folks in the community, but unfortunately that is gone completely. And that is not reflected in the budget numbers either, because that comes out of special fund.
Is there overlap between the homebound and the congregate? You have to be either or?
You have to be either or.
Okay, you can't like one day decide you want the.
No, because if you have the capacity to go to a congregate
Right.
site, then you cannot be homebound and receive meals.
Is the congregate sites, are those full or are those always taking people?
We always, we are open to taking people.
Oh, okay.
Why is 60 the age?
It's regulation. It's required by our home and community block grant, and that's how it's defined.
one more question.
And the Older Americans Act. So, the funding comes from the federal level down to the state, and so we get state and federal money for the program, and that's a federal requirement.
Stephanie, have we done any collaboration or check-in with local churches?
Yeah, I was just going to ask about that.
So our congregate sites are at some of the churches.
Okay.
Actually, 3 out of our 4 sites are at churches. But and we do have a couple of churches that actually deliver meals for us. So all of our meals are delivered by volunteers. So that it takes the bulk of one of my staff's time to be able to manage that. It takes a lot. So we have I think we have 30 routes that we run every day.
What about retail grocery stores? I mean, Fresh Market is a North Carolina company, right? And Harris Teeter is too, okay? And then Publix is really coming into this market. I'm just curious if any.
So our meals have to meet certain FDA certain requirements. So they have to be 700 calories. There are very strict criteria for them. So we contract out with a vendor to provide those meals and meet all of those requirements.
That's nutritional.
It's a nutritional requirement. So there's always a nutrition staff on board, all of the vendors or the vendor who we contract with to make the menus for the meal, all the meals that get delivered. And they have to have a certain amount of salt, a certain amount, so very, very strict criteria in order to be reimbursed. So our meals get reimbursed a certain amount. So we do get some reimbursement for each meal from USDA as well. There's a lot of detail behind it. We certainly I know we presented information over a year ago, but a lot of you weren't here, so we can come back and do a presentation if you want.
Yeah, that would be great.
Why don't you bring some of the meals and distribute them for that evening's meal? I did that once to my county commissioners. I had them deliver the frozen stuff. Not one of them took it. Oh shoot, I shouldn't say that on camera. But I ended up taking them home. And let me tell you, it's not like you're going to Longhorn.
Well, that was my next question. Any collaboration with local restaurants?
Again, we have to, in terms of spending dollars, we have procurement rules that we have to follow also.
I mean, when it comes down to it, mean, people are starving. Yeah.
Right, 11.9%. Federal government secure.
And the number keeps going up.
Can we
Can we ask them to pull back some red tape?
Or some kind of variance, allowing,
Maybe after so many starve to death, they might pull back some
or
regulations.
allowing, like, if you said it has to be 700 calories.
Well, here's the thing for me. This is one of the linchpins that keeps these folks in their home and not have to go to a family member or, God forbid, a facility because they can't perform, the duties of what do you call those? Activities of daily living. And cooking their meals is one of them. And I can promise you, one of the gentlemen that I deliver to, I deliver on Fridays. I go what's called the New Salem route. But I can promise you that's the only meal he's eating that day. I can just tell you. So it is a dire need, and it is growing. And it was 570 last time I checked, and now we're up over 600 and culling some of those out. So you can see it's not going away.
So the reason I asked about United Healthcare, and this would be like a long shot, and I don't know how you would approach it, but I remember reading and I looked it up. UNC Public Health had partnered with a local farm, and then United Healthcare gave them the grant funding, to feed, to make that happen. And so it was an interesting, group, right, that it took. It wasn't nonprofits, but it was public health with a local farm, and then they grant funded it from there. $120,000. It's called Penny Lane, and it's in Wake County, and it's been expanded to some neighboring counties. Just a thought. I don't know how you start something like that, but it'd be interesting. We are good with agriculture, and we do have public health that we get, I don't know what it would look like, but something to explore, because that was through United Healthcare.
And occasionally, just want to say that we collaborate with the ag centers. Sometimes we get some produce that we're able to deliver to the seniors as well. So we do that when we're able to do that.
Right. The other thing they have would maybe be for people who were waitlisted, which is some kind of it's like a voucher, for fresh foods for people who, there are probably people who are waitlisted who they're not homebound, but they don't have the funding. So next on our agenda, because we went way is the information on an update from the Human Services Agency activity performance.
Yes. So at our last meeting, you all indicated an interest and we would like to share data with you anyway. And so I wanted to begin that process. We collect a lot of data that is used at the service level, and we compile some of that for state reports, and we compile some of that for budget reports, and compile some of that for management reports. And one of Jackie's team's components is actually business process improvement, quality assurance, and that group is helping our department directors build dashboards and that sort of thing. And so I say all that to say performance management is a work in progress. It's something that we care about. We pay attention to a lot of data and are accountable for a lot of measures through the state, through agreement addenda, through federal contracts with the FTA, et cetera. And so what we're showing you tonight is two things that you all had specifically indicated that you were interested in seeing. The first is just a position report. So this is just for February, and obviously this can change on any given day, or at least every other week in theory. But we have 547 total positions within Human Services. That is a combination of full-time, part-time, benefited part-time, and the date that this was run, we had 510 of them filled and 37 of them vacant, which is 6.7% vacancy rate, which is really, really good. And departments, and honestly, most of the churn is just normal. You know, if something becomes vacant and it takes 2, 3, 4 months to fill that, and then we're good to go. Do you guys, for my department directors, do y'all have anything specifically that you want to talk about in terms of vacancies that are exceedingly difficult to fill?
I am extremely excited right now because DSS is running at about a 5% vacancy rate, and I haven't seen that. I don't know that I've seen that in my 7 years here. So I think between the combination between what we've seen happen across the county for staff, like we're super grateful to our commissioners. I need you to hear that, Commissioner Sides. Really, no, it's making a difference though. We're competitive because I'm going to lose staff to counties that surround me.
Sure.
Because you're already trained. You can go to MEC, you can go to Cabarrus. Not many people are going to go as many times to Anson, but like they move between where they can get more money. And right now we are very competitive. And so that is shown in the fact that I have a 5% vacancy rate. Earl, you can attest to that.
I was just going to say, Ashley, that from way back when I was in there, I think that Union County is very competitive now.
Yeah.
After hearing from some of the workers, something, we got a raise. So the county commissioners have done real well in helping out that eligibility staff.
And that is cost savings for us. Like, I don't have to retrain people. We don't have to put them back through all of the things that new staff have to go through. They already know what they're doing. I don't have to train them for 3 to 6 months. Like, it's just fantastic. So thank you.
I'll just add that doesn't mean that we're ahead of other counties. This has just brought us up to be competitive. So just speaking from the environmental health arena, this is the first time we have been fully staffed in about a decade. It's very difficult for a department to function at a high capacity with efficiency when you're always behind. You know, you cannot meet the expectations for service delivery and demand from a place of, you know, poor morale, insufficient funding, you know, unable to, you're constantly trying to catch up. So it can't be overstated how helpful this has been to the county overall.
Okay, thank you. No.
Like you're on the record as not having said that.
I didn't hear you say that.
So there are still some components, and again, we are all exceedingly grateful. There are maybe some positions that are more difficult to recruit for that we've had vacancies in, and there has been some compression, which is a normal thing. And so again, we're exceedingly grateful for the adjustments that have been made from a class and comp perspective. And if there are additional adjustments, my guess is that those would be in association with the compression. If there are additional recommendations, I guess, for adjustments, that would be in association with the compression caused by the increases that were made. And there are some specific position classes. For instance, Teresa's driver classification is one of those where the class and comp adjustment moved the minimum pay roughly $7, and that was great, right? That tells you a lot in that space. But what that resulted in, by virtue of the way that the county had to make a decision about how they were going to implement, and you have to implement across the board really in terms of salary increases, it resulted in pretty much all of her drivers, regardless of whether they had 1 year of experience or 20 years of experience, being at minimum and no separation there. So there are some buckets like that specifically that need some adjustments.
Which in that area makes it hard to recruit.
And then the other data, I think it probably would be in all of our best interest to not go through this line by line. But what I've provided for you is a couple of pages of information that is about from each of our departments very high level, just some different things that we report as part of the budget process. So just to collect that we think are some relevant numbers. There are others, and again, I would ask that if any of the directors have anything very specific that they want to call out, please shout out on this. But a couple of things that I would mention. One is I made a mistake. I'm not sure exactly how it happened, but it happened. In the comments section, there are some components that should be adjusted down. So the first one, for instance, the senior nutrition meals served, obviously that is in the appropriate place, and I'll go ahead and call that one out. That number, the target number, is related to available funding, not demand. And so some of these things, the column that says FY25 target or projected annual isn't necessarily the target in terms of, oh, that's good. It's just what we anticipate, right? Some of them may be a target, but typically it's really more what is our projected annual final number. But those that should be adjusted, the one that is on the second page is in the contracts executed line, talking about collection efforts. That's actually associated with program integrity collection efforts. And the reason for that one is, as it states, that we have a position that is doing that work that is frozen for this past budget year's cuts, and so they're not doing that work anymore. A couple lines down under the dental clinic visits, it says results include COVID-19 cases that are no longer reportable. That actually ties to the communicable disease bucket that is on the next page, page 27. And then under transportation, I think that was the last one. There's something that talks about safety, and it should have been adjusted down by 1, so that it ties to the safety management systems versus average miles per trip. In these, I know that there were some specific questions. So our WIC caseload and WIC clients, those numbers have gone up. Just for what it's worth, the state has increased our goals. The state has actually also increased funding. We have a contract position that is being funded now by state dollars. That is something that will be that we are going to present as an expansion request tied to the budget. And the logic there is that these numbers aren't going to go down, and the state funding is there, so it's not county dollars that would be needed, but it's easier to hire and maintain, and quite frankly, the right thing to do if we're going to have an ongoing need to have that built in a position versus a contract staff member. In the looking to, let's see, on the third page, the communicable disease, I already mentioned that, but the fourth one down is communicable disease under public health. That looks like it's a lot lower, but it's, again, due to COVID, and so that's not something that is alarming. In fact, actually, there are a number of communicable disease issues that the 2020, all the numbers that you see really prior to this year have been skewed. And so there are some isolated buckets that have increased within that space, and give a totally separate presentation about communicable disease.
Before you leave communicable disease, can I ask you a question?
Yes.
Have we had any cases of measles breakout?
I'm glad you asked that, because at the division report section at the end, we're going to give an update on measles and our response and our general obligation and work that we do, just as a matter of fact, so you know about that.
Still on the third page, you asked specifically about the number of children in our custody, and so in the middle of the third page, it is entitled children in custody, and that is just a number, so there is no target or projected. This is not the total number, this is the average monthly number.
Average at 81 time.
Yes.
It's just going down.
Well, so Ashley, the question was, is it going down? Not so much really, and unfortunately, the cases though are more complicated. In '23, that
It just
number-
fluctuates, it just is. So we go 136, 150, 153, 130, back up to 148. This year at mid-year, we're about 143, but we've brought about 11 kids into care in the last month, so that's just how it is.
And
Goes up and down.
the complexity though, again, of those cases is the component that is most difficult. So even looking at the average caseload, that doesn't really tell you a whole lot. Similarly, I want to call out just a couple down from that, the number of adults in care. That one has gone from 50, 53, 54, 56, 60, and now this year we're at 65. So that's relevant and anticipated to continue, and those also are becoming more complex. And then, you'll see the Medicaid cases going up, from 37,000 in FY20 to 56,000 on average now. Obviously, that's due to Medicaid expansion. And some other components in regards to that. I think one thing that I would like to call out in terms of transportation, this is just, I want to give kudos to Teresa and her team, and it's not always going to be this way, and there's a lot of times where you can't control this, but the safety management systems, the events that occur. So prior to 2023, we had included non-preventable safety events, and then beginning in 2023, it only included preventable safety events, but that's a really great number in terms of 2.6, and one of the goals in that space is certainly providing service safely and enabling people to access the services they need in a safe manner. And I think actually on that same page up about halfway, the collaborative cases, I think that's relevant just to acknowledge part of the reason for that growth is because our staff grew and we were able to fill the positions there. But just to call out the importance of behavioral health services, and that's something that the county is not obligated to invest in, but they choose to do, and it certainly is very much needed and very beneficial to the community. And I think those numbers certainly reflect that. And there are a few things. So in veterans, one of the things that isn't shown here, and something that maybe next month, unless she wants to talk about it this month, but that I think Michelle would tell you if we were looking at veterans numbers, is that the numbers, they matter, but really the outcomes. I think that's the case for all of the services that we provide, quite frankly. But the outcomes of each individual life that we are able to impact, and the claims that are able to be settled, and the assistance that we're able to get to help change people's lives is really something that is much more meaningful than just the numbers that you would look at in terms of the raw numbers of people served.
On the subject of veterans, how many homeless veterans do we have in Union County? How could I find that out?
Commissioner, there's really no way to track that. We do keep in contact with the community homeless shelter, and there's a point of contact there that keeps track of the veterans, and it's anywhere from 2 to 10 at any given time.
That doesn't include
Not acceptable.
doesn't include the unhoused.
Right, and the VA homeless program defines a homeless veteran as a couch surfer or someone that stays with their family, not necessarily on the street homeless.
Right.
Someone that's displaced out of their home.
But those
Displaced,
are
that's
shelter
what
that are counting if they're at the shelter.
Correct. Right.
So there would be more that were unhomed.
Right. And
I'm sorry, what was that?
So those would, the 2 to 10 would be how many were unsheltered if they were in a shelter, and then unhomed, or what is it called? Is that really, would be higher than that?
correct.
Displaced.
Displaced, yes.
Displaced. That means they're living with family or friend or wherever they can crash on a couch.
Right. Or out of their car, and maybe they haven't checked in anywhere, and so no one really knows their office.
Well, I'll just say as a father of my oldest son is serving in the Army. And as far as any veteran being displaced, homeless, whatever you want to call it, it's unacceptable. So what can we, this is a loaded question, not for this meeting, but longer. What can we do about it?
Commissioner, can I ask something too? Is there any way that, right now, well, I guess that's a state thing, but is there any way that the board or commissioners could advocate for making the taxes? Right now, I think it's like 27% of your tax, real estate taxes, non-taxable. Is there any way they can advocate to make it like some other states where all of your personal property taxes for your homes are non-taxable?
Well, that's,
For
that'd have to be state legislation.
That's what I'm saying advocate possibly.
I'd be more than happy to, if we can get somebody to write a bill, I'd be more than happy to advocate for it. But as responsible for Union County, as far as I'm concerned, I'd like to know what avenues there are to make sure there is no veteran in our county that has served our country that is homeless or displaced or living in their car. I think that is, you want to talk about a waiting list of 590 names? Homeless veterans right up there with me.
Yes, sir, I appreciate that. Unfortunately, the percentage of homeless veterans is due to mental health issues, so it's a bigger issue of homelessness. It's also a mental health issue, and some of them choose to be homeless, just because it's easier than having to deal with the parameters that are set under
Sometimes it's
apartment
homelessness
rental
by
contract.
choice.
Correct.
Yeah. They're avoiding the system.
Absolutely.
I get you.
Thank you.
Have you seen an increase in job loss in veterans here? Like they're reporting nationwide, or it hasn't yet?
No, we've had several phone calls recently about mortgages, not being able to make their mortgage, not being able to make their rent.
So hopefully, well, if you guys have any questions about this, I think probably it would make sense for us to come back to it. If any of the directors have anything you want to call out specifically that I didn't mention, just the matters that is a trend that you're seeing right now that will impact us greatly that we maybe haven't already touched on, please do. And then I want to mention, I mentioned the dashboard information. We'll bring some additional information to you. But there are things like, that we track, like literally just the number of people that walk into this building. So Jackie and her customer service team, as a for instance, in FY 24-5, so for calendar year 24 that we just finished, we had almost 25,000 people just come through the doors that they greeted. And so, the majority of the services that we provide, quite frankly, are probably done on the phone or electronically or through, other types of engagements. And so having that many come through the doors for service as well, it just,
That's amazing.
there's a lot of volume.
54,000 phone calls.
And 54,000 phone calls.
Holy smokes.
I have a general question. Volunteering, what is your need for, maybe you don't answer it today, what is your need for volunteering? Do you post that?
So Stephanie can probably speak to, oh, look, excellent. Somebody's taking us, thank you, whoever's driving right now. So we have multiple different volunteering opportunities. Obviously, as Commissioner Sides mentioned, volunteering for senior nutrition at different times of year. Like right now, we have a number of volunteers who are helping with what we call VITA, volunteer income tax, so preparation for that. You don't have to be a math person to do that. It probably doesn't hurt. But you don't have to be a numbers person, you just have to be able to use a calculator and.
No, you gotta pass an exam too.
And pass an exam.
Sorry, it's not just a calculator, yeah.
Christmas Bureau, obviously, we have a number of volunteers, and then there are some other just opportunities in general, and if you or someone you know is terribly interested in helping support operations, there are a number of things that we couldn't allow assistance with, just due to HIPAA and other, access to information components, but there are a number of things. So Nicole, like in communications, we have a lot of internships and that sort of thing. And she happens to have an intern now and is super excited about it. And that's not volunteer, but it's part of this, Stephanie, there's something specific on the website that you would like to mention? Sorry about that.
I think right now just clicking on the nutrition program, and we're always needing people to help deliver meals. It's not always really, it's morning time, so it's not always easy for everyone. Love to have kids do it, but it's usually not at a time where, 18-year-olds, or maybe if they're flexing, but it's still really, really hard. We also require for our nutrition program that you go through a background check, because it is a vulnerable population. We don't want to send someone out who has a sex offender history, so we do have to look at that. We'll have some opportunities for like Easter baskets and that kind of thing. We'll take donations, but in terms of other volunteer opportunities, really year-round, it's senior nutrition, Christmas Bureau, and then our volunteer income tax program, and that'll be over in April. So
And
that's
with
about it right
library,
now.
obviously, Nicole and the public communications team have done an awesome job. If you haven't checked out the website, I wish that you would have like 5 years ago and then checked it out now. It's really good now, but if you compared it from any number of years ago to today, you'd say, wow, this is such an awesome review. But in terms of, you can see a little bit there, library and parks and recreation, there are some other departments that have opportunities as well. Is that helpful?
Yes, thank you. And if any of you are or know someone who is considering helping deliver with senior nutrition, it takes me an hour. From door to door, it's an hour. I'm done. I delivered 7. It's the usual route. I live in Monroe. I pick up at the Bazemore Senior Center, and I've got my farthest away delivery is practically at the county edge up in New Salem. And then it's very easy to do a route, and 3 of mine are right in Monroe, but I can do it an hour, door to door.
And we have to deliver the meals within an hour, so because of keeping the meals warm, we have to keep them in temperature and that kind of thing. But a lot of the routes have shrunk a little bit, so it might not even take more than 30 minutes to do the actual route. But that's a little bit of a longer route.
Is it?
Just because of the distance across, I think.
Yeah. My wife drives, so it doesn't take long.
That's good.
All right. We've had some good dialogue on that. Go ahead and start us on our next one, was to receive information on the child fatality and prevention and community child protection team.
So this report is going to be a tag team between Ashley Lance, Social Service Director, and myself. I'm going to present the first part, and I wanted to start by just giving you a little bit of background since we have some new members. In the 90s, North Carolina established the North Carolina Child Fatality Prevention System. That's a statewide, multidisciplinary, and multi-agency system. And that includes the North Carolina Child Fatality Task Force and local child fatality prevention team, which is what we are. Sorry, can you hear me better now?
Yeah.
Which is what we are part of, and what we're going to be providing a report on. So the purpose of the local team is to prevent future deaths by identifying gaps in the systems and policies that may have contributed to the deaths of infants or children in the county. And then we have the ability to make recommendations for improvements as a part of that North Carolina fatality prevention team. We can provide information for that. So the report that we're going to be giving this evening is for 2024. During that time frame in 2024, we held 4 reviews. Those are quarterly meetings. And as I mentioned, it's a multidisciplinary team. And during that time, there were 19 child deaths, infants and children, that occurred. And those are kids from birth to 18 years of age. The causes of deaths, as you see in the information, 6 due to perinatal conditions, that's prematurity, 5 deaths due to birth defects, 3 due to accident, no homicides, 3 due to illness or medical conditions, no suicides during 24, and 2 due to other. So there were a total of 11 infant deaths. The leading cause of deaths for infants was a perinatal condition. For this group, the specific causes of death were 6 of them being perinatal, 3 birth defects, 1 unknown, and 1 illness medical condition. There were a total of 8 child deaths in 2024. For this group, the specific causes of death were 3 being accident, 2 being illness or medical condition, 2 birth defects, and 1 being of unknown cause of mortality. If we break these kids up into categories, 5 were males, 6 were females, 2 males were black, 2 females were black, 1 male was Hispanic, 2 females Hispanic, and 1 was Asian Indian. So we made some team recommendations as part of this process. One was early intervention. It's just important when it comes to substance abuse. The earlier you can intervene with those types of situations, the better the outcome. Make sure kids have a flotation device, floaties on them if they're near or have access to a body of water. All infants in the NICU need to be referred to Caremark. That's a referral program that follows high-risk kids and also pregnant women, incidentally. The team has also submitted to the North Carolina Department of Transportation a formal request asking them to review one of the locations where an accident occurred to make sure that the visible signage is appropriate, enough for that dangerous area, because we're aware that there have been several accidents in that area. Perhaps install speed bumps, guardrails, whatever is necessary, but a formal request was submitted to NCDOT to evaluate that location. So I think Ashley's going to take over now. Before she does, I just want to give a shout out to Dave Flaherty, who has done an amazing job supporting the group this time. This is a new job for him. He has done a fantastic job. Thanks, Dave.
Just to clarify one thing on the child fatality prevention team, we reviewed those deaths in 2024, but they actually happened in 2023.
Oh, excuse me.
No, you're good. It gets fuzzy sometimes when that happens because we get them the year after they occur and we review them each quarter.
Thank you for correcting.
Yeah, you're welcome. And so in Union County, we, for the longest, have always had a combined child fatality prevention team and community child protection team. And so while we do review the child deaths that happened the year before, we also have a section that is community child protection. And the way that that operates is we're able to bring very difficult cases within child welfare at DSS to this group. And then we have a multidisciplinary team of members who are able to brainstorm and come up with different perspectives of ways that we may engage with the family, interventions we may be able to provide. And so I was going to cover the 3 cases that we went over this past year at our community child protection team, just to kind of give you an idea of what we're doing. But like the main task of this group is so we can look at those active, like we are in the home working with this family trying to provide services and intervention. So these are very real and in the moment, and child fatality prevention is a year after the deaths have occurred. So the first case that we reviewed this past year, and of course for confidentiality reasons, because this is or was an active DSS case, I can't give you any information that would connect people to these cases, so this will be a broad kind of overview. But we discussed a first case which involved improper supervision. A young male was degloved by a piece of exercise equipment, and the guardian went against medical advice given by the hospital and sought out her own care. And the child eventually did receive appropriate treatment a few days later. Our team recommended an assessment for the guardian and in-home care for the child as part of our recommendations from the team to the social worker. The second case had multiple CPS reports. One was actually for human trafficking. The guardian was unable to work due to medical issues and had little to no income. And so the kids, in an effort to try to take care of the parent, were doing what they could do to take care of the parent. The children were not attending school. They were having very significant behavioral issues, and the team recommended locating alternative housing and exploring alternative school settings for all of the children. The third case involved a dependency report due to a guardian refusing to pick up his 11-year-old from the hospital. The child was admitted due to homicidal ideation toward his family. The child was reported to have intellectual disabilities and no insurance. The other guardian had prior CPS reports in another state, and so wasn't an option for the child to stay with. The Community Child Protection Team made a ton of recommendations to this one, and I can tell you that they were very helpful in these recommendations. Following up with Charlotte Autism Services, Autism Speaks, RHA Health Services, NC Star, Easter Seals, UCP, worked together, NC and the Union County DSS Medicaid department, because there were some issues with the child not qualifying for Medicaid, but sometimes there are the system is hard to figure out, and sometimes there are other ways they may qualify. And so we were able to work with our Medicaid department on that. We did report some systemic limitations to the state. It's another part of the Community Child Protection Team is to get back with the state and let them know what our county is really struggling with, and one of those is limited services or no available services. I will tell you most specifically that is in relation to mental health and substance use services. We have some, but does it meet the needs of our very fast growing community? No, it does not. So we're letting them know that we need some help there. Limited services for youth who have dual diagnosis of mental health and developmental disabilities. That's always been difficult. Limited access to health care or no health insurance. We've seen some of that increase due to Medicaid expansion, but there are still gaps. Limited community knowledge about available services. This is why sometimes DSS ends up getting involved. The system is hard, y'all. Trying to figure out how to navigate that as a parent who's already struggling just to feed and keep your kids safe, like knowing where to take your kid, if they need mental health services, how to get insurance, like all of that, and navigating all of that is part of what we're trying to do at social services. And then of course, limited finances. So those are the cases we covered in Community Child Protection Team. Yes, Earl.
Ash, I was just looking at your second bullet, and the question I was going to ask was about the human trafficking. And you know, they always say the Charlotte area is one of the very large across the United States. And I was wondering, was any of that trickling down this area that you know of? And what comes to mind was, I don't know if it was a year and a half ago, there was some young girl, 15 or something, and she luckily, or thankfully, that she was able to get back. They got her back. She went out to Missouri or Arkansas someplace, and then she came, but somehow she got back. But some guy picked her up, walked out of her house, and just, I'm not sure if that was this particular case, but do you see any of that trend kind of trickling down into Union County?
Yes. Not just via Charlotte, but kind of, because we have the interstates. A lot of our connection, honestly, Charlotte via Atlanta. So it comes up that interstate into our area and then branches out into the suburbs of Charlotte, which is Union County. And so that is what qualitatively I've noticed throughout DSS that we've been dealing with mostly. Thank you, guys.
Question
Oh, yes.
or comment? Okay. Pardon my naivety on this. You use the word guardian several times. Do we ever use the word parents? Are these not necessarily parents? Are they parents?
I just
Or is it
intentionally did that to help lessen whether or not I was giving away any confidential information. I know that sounds crazy,
Okay.
but I just said guardian.
Okay, that's fine. That's what I kind of figured.
Yeah.
I just wanted to-
Just trying to keep it as vague as possible.
I think this is great that we've had these organizations, these committees and what they do. It would be more, like when I read this, I guess coming from where I come from, the field, we monitor trends. And it's like, this would be more impactful to see what impact it has made. So this was established in the 90s, right? So there had to be a reason why it was established. Was there a problem, an issue? And has it made an impact? And so I guess like, if I were to see something like this, I see these numbers and I go, okay, that's great. But is it, or compared to last year or the year before, or like, are these numbers better? Or are they worse? I don't know what this is telling me.
It changes every year. I can tell you historically that some of the big initiatives that have come out of child fatality prevention are things that you see like seatbelts in cars and child safety seats. Those were a big push from child fatality prevention teams back when they first got started. Specifically, like there were already seatbelts in cars, right, in the 90s. But getting the information and pushing the information out, also with sudden infant death syndrome, safe sleep, has been a big push out of child fatality. I can get the numbers year after year.
Improvement from last year.
Yeah.
And an improvement in
Okay, so
disproportionate.
that's what I mean.
Yeah.
I don't know that because I'm seeing this and I'm going, okay, this is 23. Is that better than 22? Is that better?
So the
than
state-
21? What have we done? What are the things that were done to make the impact, to make it better? That's all I'm asking.
No, you're good.
It's a good presentation, but that's what I'm saying.
So we're required to report to you, or just a report out of what we did throughout the year. The state, we also send this to the state, they compile the data, and then they release a full annual report that will show historical trends.
Okay, that's what I'm saying.
So once we have the full state report, we can make sure that that gets emailed out to our board members.
Is that still under NC State?
Yes, Qualtrics through NC State.
Any other questions on the child fatality and child protection?
Just a compliment. I think that's a great effort. I didn't realize, like many other things I'm learning, I didn't have any idea about this initiative, and I want to compliment you all. That's serious work.
I will say it's the most depressing meeting every quarter.
I can imagine.
Yep. I can attest to that.
I can imagine.
There are no other questions on that. We have the director's report. Is that right?
Division reports.
Division reports. Sorry.
I'll go first. That's okay. Unless someone else wants to go. All right, so public health has three things we're just going to touch on. One thing I wanted to make you aware of was the recent oyster recall. There were some waters off the coast of Louisiana that were closed due to norovirus illness associated with oysters. Part of what's required when oysters are harvested is a tag that notifies where those oysters were harvested from. So if there is a recall or an illness, those oysters can be traced. So the oysters that were harvested in the waters of Louisiana were tracked to certain states where the products were distributed. North Carolina was one of them. And so the information came from federal to state, and then North Carolina counties were notified. We were notified because of those North Carolina received oysters. Union County received several bushels. So we in environmental health were notified of who purchased those bushels. It was a facility here, there's no need to say the name,
When we arrived there, one bushel had been sold, distributed, so they got out before we could get there, and the other bushel we were able to stop before it was sold at the retail level. So it just represents illness prevention and some of the work we do behind the scenes. The other thing I was going to mention to you, and Amy had emailed me about this, we were actually already aware of it and we're working on it. I don't know if you have heard about the frozen shake recall that was distributed to long-term care facilities. So we pushed that out, and that came out in the news, but we were notified of these frozen shake products, 2 different brands that were marketed and sold to long-term care facilities. There was actually a death and several illnesses associated with it. Again, North Carolina was identified as receiving those products, and that product was traced to North Carolina. My staff in environmental health went out and visited every single long-term care facility or contacted them. We did find that product in 3 long-term care facilities, and we're able to remove that from service to those folks. So that's just another example of kind of what we're doing over and above just our regulatory inspections, that kind of thing. So just wanted to make you aware of that. Does anybody have any questions?
Any measles outbreaks in the county?
Yes, so that's the third thing.
Oh.
And these ladies, this is Ashley Burt, she's our nursing director, and Megan is our supervisor for the communicable disease program, so they're going to talk to you about the measles.
All right, so everybody's heard it on the news. Measles is a virus, it's a respiratory virus. Earliest notes that are back in the 9th century. Here in the U.S. in the early 1960s, a vaccine was developed. Later in the 1960s, that vaccine was improved. And 30-ish years later, by 2000, measles was declared to be gone from the U.S. We had a lot of years of no ongoing transmission. Next slide. So the 3 C's are the way that the symptoms are described. It's cough, coryza, and conjunctivitis. Coryza is just runny nose. Conjunctivitis is red or inflamed, irritated eyes. Those 3 symptoms, along with fever, which can be up to 104 degrees, are classic symptoms, followed by a rash. It's flat, usually starts in the face and then kind of works its way down to the rest of the body. The symptoms start usually a week to 2 weeks after the person has been exposed. The rash that comes later, a person is infectious about 4 days before the rash shows up. So they get exposed. Week to 2 weeks later, they start having, a runny nose, a little cough, not really thinking much about it. They become contagious, and then 4 days after that, you see the rash and go, oh, this is more than a cold. That's kind of how that progresses. There's not a cure for measles. There's not really a treatment that's going to make it better. There are things that can be done to lessen some of the secondary infections or some of the inflammation that can occur, but not anything that really will fix it. Another symptom that can show up is Koplik spots, white spots in the mouth, just kind of as an aside. All right. About 1 in 4 people who get measles will be hospitalized. Common complications are diarrhea and ear infections. Severe complications can be pneumonia or encephalitis, which is swelling in the brain. That only happens to about 1 out of every 1,000 people that get infected. The long-term effect from measles can be subacute sclerosing panencephalitis. And that is something that happens when somebody's infected with measles, they seemingly recover. Months, years down the road, they start having some cognition deficits, behavior changes, then the muscular system is involved. There's like flexing and writhing, and eventually more brain function is lost where they don't breathe. And again, there's not any cure for that. This happens in about 1 to 2 people out of 1,000, so it's pretty rare, but very significant when it does occur. Measles spreads very easily. We kind of hold on to it in our mouth and nose, and so then when you sneeze, breathe, sing, anything like that, the virus can spread. People that are around somebody with measles who are not immune because of vaccination or a previous infection, about 90% of those people will be infected with measles. Already talked about the time frame and how easily can measles come to Union County. Well, we watched it in, kind of staying in Texas for a while. Now it's in 12 different states. Virginia is now the closest to us. Last week I thought, okay, Florida's the closest that it is. Well, not anymore. It's getting closer. So it's very likely that we will have a measles case. So far we have not. The best thing that we can do is to, try to make sure people are aware. One of the things the CDC and the state does is they send out notices that we push out to our local providers. Some of our providers may have seen measles, but there's an awful lot of them who haven't ever seen a case of measles. And we want to make sure that they're aware and that that's on their list of things that they're going to check off when they're seeing patients. So in 2000, we said it was eliminated. There was a big jump in that number. In 2019, there was a large outbreak, kind of New York State. Most of what happens is that travelers go out of the country, they're not vaccinated, they get infected with measles, and they come back to their communities where there are other non-vaccinated people, and that's where it really can take off and spread. And so that's what happened in 2019. And we had a few years where we had 11 cases in the country, 50 cases in the country. But by 2024, we were up almost to 300, and right now we're at 222 plus, and we're only 3 months into the year.
Wow.
All right. So many people ask, how can we protect ourselves against measles? Vaccination is going to be the best protection against measles. With 2 doses, it's 97% effective at protecting against measles, so preventing those infections. 1 dose of MMR vaccine is 93% effective at protecting against measles. One thing that we do monitor for, so if we get notification of exposures to measles, we can provide post-exposure vaccination. The downside is it has to be administered within 72 hours of exposure to be effective. And as many people know, especially with an 8-day time frame of infection, a lot of times pinpointing how many people are exposed, when they were exposed, where, and then getting that information out to those that were exposed. It takes a lot of man work and time, and we're kind of racing against the clock in those points. Who should be vaccinated? So really, anybody that does not have evidence of immunity. So that would be evidence of 2 doses of MMR vaccine separated by at least 28 days. That's adults, children, international travel. So with routine vaccination, children get their first dose at 12 months, 12 through 15 months of age, and then their second dose at 4 through 6 years of age. So if they have high risk, such as exposure or travel to places with endemic measles spread, they would get that dose 6 to 11 months. But 6 months is the earliest they can get that first dose. Sometimes it is contraindicated to get an MMR vaccine, so anyone who's had a life-threatening allergic reaction to the MMR or any of its components, anyone who's had, so we screen everybody who comes in, every single appointment for Union County Public Health for up-to-date vaccinations, especially children, to ensure if they are sick at that time, sometimes it may be advised that they defer that vaccine until they are well. Also, pregnant women should not get the MMR vaccine. And really, anybody who has had another type of vaccine or live vaccine within the last 4 weeks will defer that vaccine until 4 weeks has passed. And then the big question is, what are we doing in Union County to help protect residents? One is vaccination. We screen patients at each visit for their vaccination status. Our nurses screen for eligibility, and then when vaccination is appropriate, we offer that. Vaccines are provided according to ACIP recommendations, and we go by standing orders. And then for surveillance, our CD team, we do daily monitoring for reports of communicable diseases and emerging conditions. This includes ongoing investigations, analysis. We share data about communicable disease and vaccine coverage. And just as an aside, for Union County, for this past year for kindergarten and vaccine rates, coverage rates, our exclusion went up to 6.7%. The state average is 2.8% for exclusion. So that's children who enter kindergarten who have, typically it's a religious exemption for vaccine exclusion, so they're not getting those vaccines. Yeah.
If a person has had measles when they were a kid, how long will that give you some type of immunity? Will you ever get it again?
It does provide those antibodies. I'm never going to say never because, immunity does wane, but it's very unlikely.
So the person also with the vaccine, someone had it when they were a toddler, and now they're much older now.
Right.
Does that last for that vaccine forever?
Again, I won't ever say ever, but typically, if you have those two vaccines that you do have proof of immunity, that's considered proof of immunity. Just FYI, I got my MMRs as children. When I went into nursing school, I had proof of immunity through titers. And a lot of times, so when we have these exposures, we can offer those titers. So, if people don't know if they have that proof of immunity, they don't really want to get vaccinations, we can offer titers as well as a proof of immunity. Mm-hmm.
Do we have the numbers in surrounding counties across North Carolina? Like, compared, you said we went up in Union County. I know the state average. Do we have numbers on the other counties?
There's actually a dashboard. It's the kindergarten immunization dashboard, and that it will break down like by county what that exemption rate is.
So I have a question on that, because I thought on the dashboard that it said we had 6.2% of the kindergartners were not vaccinated for the state, an increase of 625 new unvaccinated kids from the previous year in percentages.
I may have just written it down. I'm sorry.
So I think it was flipped, but I'm not sure, but that's why I knew Union was higher than the state.
Yes, we are much higher.
And we are still on the rise. So I guess my question was if it wasn't flipped, if it was just when we say kindergartners, is that just public school kindergartners, and that could be the difference? Because it was two different numbers. So it said 6.2% of kindergartners were not vaccinated. An increase of 625 more was about the exemption. And so I was like, how did they, don't you have to have the exemption don't you have to file for it? You can't just not vaccinate you unless you file for an exemption, right?
Unless you're homeschooling and you're in that age group where you would be vaccinated.
Which means your number could be correct. That's what I was saying. Like it could be kindergarten age is 6.2, and then the public school was the other. That was what I wasn't sure of.
And the surrounding count, like in our region where
higher than those counties for exemptions and,
Are we higher than
lower
Anson?
for compliance.
Coverage.
We're high, yeah, for everybody else.
And compliance both?
Yeah.
So, to answer my question, we don't have any cases currently, knock on wood, of measles.
Not in North Carolina, not yet.
Okay, or in Union County. Second of all, how did y'all know I was going to ask a question about measles and get this presentation?
Well, we know, I mean, we know it's a public health concern, yeah.
No, it's really a current topic because it is spreading, and that is alarming with our unvaccinated rate. Now, well, I had the vaccine when I was younger, but I only had one shot. Now, this is a long time ago. But was that when the first phase was only one shot?
Yeah, you can draw a titer.
You have to go back and get another one?
We would love to see you, Commissioner Sides.
Well, somebody better be ready to catch me if it involves a shot.
You know, we don't have any yet. We hope we don't get any measles here, but we're making a plan for if we do. Like, what education can we get out there? How can we make sure medical providers know what to look for and to call us so that if it does happen, we're ready to jump on it and hopefully, minimize the number of people that get exposed.
That's a good-
Surveillance and
You brought up the point that
preventative.
if they haven't seen it before, they don't know what they're looking at. Oh, you got a cold, you got a runny nose.
Surveillance and preventative actions are much easier to manage on the back end. They're also much cheaper and less suffering. So it's very, very important.
Are there cases in surrounding counties?
None in North Carolina.
Nothing right now. Not yet.
Did you have a question?
Yeah, I just had a quick question about these new cases. Is this occurring in a population that is vaccinated already, or is it?
So 92% of the cases that have been identified or reported so far were unvaccinated.
Was that number 92%?
92%. Yeah, and that's from the CDC.
And the outbreak began in, western Texas in a group of unvaccinated folks there.
Unvaccinated folks
People
From
a Mennonite
from
Did they
group.
come from other countries?
Oh, I don't know that.
not necessarily
Because
typically.
I've spent time in the Philippines and done medicine in the Philippines, and I've seen measles. I've actually seen lots of measles. Didn't get it, at least not that I'm vaccinated. Our country, it's generally, as you pointed out, it's very rare because we have a strong vaccinated programs. Other countries do not. The numbers you say, I know, seem like they're a lot, but if you kind of relative to the country, that's pretty small numbers. But they're probably coming from somewhere. Well, my point is, it's probably not here.
What they
It's being
found
brought from other places.
in 2019 was the outbreak in the Jewish population in New York, and then here. It's an unvaccinated group of people who then travel to another country that does not have any herd immunity.
Right.
They bring it back to, so it's not that somebody's, coming, it's not being imported from a non-US person.
Sometimes.
Many
all the
times,
time.
not always, of course not always, but
There's many diseases that were eradicated and now we're bringing them back.
And really, so the big thing is, doing education for not just local providers, but our school nurses, child care providers, one, to identify any potential pockets of vulnerability. So if we have pockets of unvaccinated children, knowing where that is. And so you have a low threshold of suspicion. So if for some reason someone did develop symptoms, you kind of have, it's already on that radar. We're working actively to bundle a few different education campaigns to help provide information about measles, vaccination, clinical diagnosis, testing, control measures, so that those populations already have that information So when the case does come, they already know the steps. They have that foundational knowledge to respond. And then, of course, response preparation and communication. We send out health alerts from the CDC. We're working closely with community partners, our CCHC nurses who serve our child care centers. And then, as information comes from the state, we promptly disseminate that. Any other questions?
Any other questions?
I have a quick just question about TB, because I know Charlotte Meck had a pretty significant TB outbreak. Have we had any more TB cases in Union County?
Oh yeah, so there's many. we had a significant increase over the last year. There was 1 week where we got 4 cases in 1 week. And we've worked really hard. We respond. There have been no identified EpiLink cases, so no spread. Most notably, I think we did an update, especially when we had the Porter Ridge exposure. We did testing. No other cases were identified with that testing. Now, of course, some students deferred testing, parents declined testing, but there were no other identified infections. So we are counting also LTBI cases, which are latent cases, not just TB disease.
Okay. Yeah, I just
yes, there's definitely been an increase.
So you're saying since that identified Porter Ridge case, we have had more TB cases, or
yes, ma'am.
Do
not
we get
linked,
updates?
not linked to that, but
no, but just in general, do we get updates on that, on numbers on that in this setting?
Yeah,
If you want that, we can build that
I'm
in.
just curious about it.
We typically get that update annually with the CD update, but absolutely we can provide that before then. Thank you.
Any other questions?
I'm making this quick. Everyone received a card or should have received a card. We are doing our community health assessment. We do that every 3 years, and we have surveys that we need you to do. We have it in English and Spanish. There's a QR code on here. We have gotten a lot of information out on all our social media and to our community partners. It's really important. We're trying to get feedback from the community for you to complete this. And I have some rack cards here if you'd like to bring some back to your work or other places. I have a lot more upstairs. So just let me know numbers. We can drop them off. We can do whatever you need us to do. But we really want to get as many people to complete it.
I just want to talk about the growing need of all human services departments. Last year in FY24, we did over 78,000 trips in transportation. Of those 78,000 trips, 44,000 were for our seniors, anyone over 60. This year, we are on track to do over 89,000 trips. That is 11,000 more than what we did last year. And it is just the aging population in this community is growing, and it's growing rapidly. And they need all of our departments. And we have a huge unmet need. Transportation only runs Monday through Friday. We're out there at 4:30 in the morning and we're done by 6. There is a bigger need than what we're doing today. And we need to figure out how we get to that unmet need so we can go to the board and ask for more time, more days, more hours to help our population. Thank you.
I have a question on that. Wasn't there a study that we looked at, I can't remember if it was here or with your other group, Stephanie, where we looked at transportation and they looked at Wilson, North Carolina and what they were doing. They looked at expanding CATS all the way to Wingate and having a Matthews stop. There were different options we were exploring.
So Wilson is doing the microtransit.
Mm-hmm. Yeah, so what was the outcome with that?
So we did, so that was, Bjorn Hansen did that. And the study that we did was inconclusive. Didn't give us much of anything. So that's why we have to figure out how we can get to that unmet need. We know what's out there. We're doing a pilot program right now. Someone else is running it, and they're hitting the schools and everywhere else, but it's hard to get that information. So we go to employers. Employers come to us. They say, can you help us? Sure. What do you need? Well, we don't know. We've got to figure out what it is that they need. They know our hours. They know we only work certain times, so they're not going to call and let us know they need trips, because they know we don't work those. So that's something that in the future, near future, we're hopefully going to be able to figure out and do a study on and get more information.
Have they seen a shift in the numbers with Medicaid transport changing this year, like, you know, outside of y'all for different hours?
So our numbers have grown from the brokerage. We're doing a lot more transportation, but there are other transport out there. Right. So one of the things with that is, you know, for dialysis, they're 3 days a week. So if they're Tuesday, Thursday, Saturday, they won't give us the trip because we can't do Saturday. They'll give it to another transportation department. But yeah, there's a lot.
And that would be something that we would take to the commissioners for y'all to be able to do Saturday, or that's not what the ask is?
We need to know what that ask is, right? We need to know how much we're not doing. Because I can't go to the board and say we need Saturdays. They're going to ask me why. Why do you need Saturdays? Because you're going to need more employees. You're going to need more vans. You're going to need a lot of different things. You're going to need dispatch. So if I don't have a solid case of exactly what I need.
So will DHHS have the numbers on that Medicaid transport with the other brokers at the end of the year? Like with the expansion?
I mean, that's something I could talk to the brokers about, but I'm not sure how much they're going to share their numbers with us.
Yeah.
What do you mean by you said brokers?
So Medicaid brokers, so DHHS.
Transport that Medicaid.
Correct.
Okay. How many vans do we currently have? How many drivers do we have?
So that is a loaded question about vans. Today we have 28 vans. Today we have 28 vans.
All right.
Since COVID, those vehicles are not built the same. So although we have 28 vehicles, we'll have 5 off the road at any time for repair.
Huh?
They're little things that we have Ford vehicles, so little things that Ford is not doing. The recalls that are happening. They're just, those vehicles are not what they used to be. So there's a lot of mechanical issues that happen with them that take them off the road. Right now I have 5 vehicles off the road.
Out of how many?
28.
We have 5 off the road?
Yes, sir.
How many miles do you put on average on these vans each year?
I'll tell you, we do almost 700,000 revenue miles. So that's miles with someone in our vehicle, in those 28 vehicles. So you could say we do anywhere from 40 to 50,000 a year. And the useful life on a vehicle is 100,000 miles. So at 100,000 miles, they have to make that 100,000 miles, and I can request another vehicle, but it takes me a year to get that vehicle. So by the time I get that vehicle, we're looking at 150 to 160. And there was a backlog, so some of our vehicles have 200,000 miles on them or more.
So it's really amazing thinking about Teresa and the team, the addition of the trips that have been done and that we're on track to do this year are being done with the same size fleet basically and the same staffing. And so from an efficiency perspective as well. So not only is the demand there, but the team is knocking it out of the park.
And to answer your other question, we have 36 drivers. So we have a combination of full-time drivers, benefited part-time drivers, and part-time drivers.
Are those white vans with the Union County sticker on them that I see outside of the Bazemore Center?
Yes.
You have to have a CDL to drive those?
No.
You don't?
We're just under the CDL requirement.
Oh, okay. How many people do they hold?
It depends on the vehicle. So we have minivans that hold maybe 2.
Yeah.
Which we're getting rid of because our demographic is, they're just not good for them. And then we have 13 passenger, and then we also have 8 passenger, 2 wheelchair.
We need to talk.
I'm here.
Have a van?
No, about getting
some more.
some decent ones, yeah.
You like a bigger fleet?
Hi, Michelle Marcano, Veteran Services. First of all, I want to apologize. I've missed several meetings in the last couple months, and I apologize to the board for that. Veteran Services is doing fine. I just want to say, like Janet mentioned, a lot of what we do is an uncountable measure. I would love to bring some personal statistics to the board at some point with personal stories and how we touch them and how we change their lives. If they would want to come with, I would love to have them come share their story. For example, in December, I'm still kind of on the high of my December win, if you want to call it that. Won an appeal that we took to the law judge on a denial for a disability claim, and the gentleman got a back pay of $180,000. I mean, that's life-altering to some veterans. And he was ready to give up, and I refused to let him get up. So, give up. So just, those are the kind of stories that I would love to bring to you, because those are things that I can't really capture in a number, except 180,000.
Good job.
Yeah.
Thank you.
Amazing.
Hey, Ashley, DSS, I don't have an update. It's 8:30, that's your update.
Y'all put in the full day already.
I don't have anything else except to welcome Noyce Harrigan, our new member, who is filling one of our engineering position. Would you like to introduce yourself, sir?
Hey everyone, I'm Noyce Harrigan. Like you said everything, I'm an engineer. I moved to Union County in 2008, so this is my first board, first community service gig, so thanks for having me.